Maggots, leeches, skull drilling, shock therapy, and yes, using someone else's poop. What do all of these have in common? That they're used as medical treatment in hospitals today. I'm Dr. Asya Mubashir. I'm a US trained internist and a rheumatologist, and today we're going to talk about some bizarre treatments, and honestly, some of them really surprised me too. Let's get into it. If you lived in China between the 3rd and the 4th century and you were sick with diarrhea, most likely you were going to be treated with yellow soup. Yellow soup was made by going to your neighbor's house, knocking on their door, asking for their poop, turning it into soup and drinking it. The idea was to take someone else's healthy gut bacteria, ingest it to heal your own body. In 1958, Dr. Eisman and his colleagues did exactly that. They noticed that patients who were sick in the ICU from severe diarrhea were losing millions of healthy gut bacteria, and they could get better by using donor bacteria. So what they did was they took poop from healthy donors and put it inside the rectums of sick patients using a long, thin tube, and this is called a fecal enema. And in modern science, this is called fecal microbiota transplant, or FMT. FMT today is used to treat severe infectious diarrhea from Clostridium difficile. It is also available in an oral capsule. Next up is maggot therapy. Maggots, I know, stay with me. During World War I, military surgeons noticed something really disturbing and something that they couldn't explain. Soldiers with maggot-infested wounds were surviving surgeries that should have killed them, but their wounds were clean, less infected, and healing faster. How could this be? Maggots are the only biological agent that can debride with great selectivity. Maggots were eating up dead tissue and leaving healthy tissue alone, something a scalpel could not do. And modern maggot therapy today is very sterile. These maggots are grown in a lab, placed in a sterile mesh, and then placed on the wound of these patients, so maggots are not flowing freely on the wound. Today, maggot therapy is used for diabetic foot ulcers and non-healing wounds.
Here we go.
That is electroconvulsive therapy or shock therapy. And interestingly, modern ECT looks nothing like this today. It is performed under general anesthesia with continuous monitoring and muscle relaxants. Patients actually sleep through the entire procedure. The convulsions that you saw in the video, they don't exist anymore. So where did ECT come from? Electroconvulsive therapy was first performed in 1938 by an Italian psychiatrist, Dr. Ugo Carletti. Dr. Carletti noticed that right before pigs were taken for slaughter, they were stunned with electricity, and this induced seizures. And after the seizures, these pigs not only survived them, but they appeared calmer. And he wondered whether inducing seizures in patients with severe depression would help them. He performed his first procedure, and rest is history. It spread through Europe and the United States. ECT today in psychiatry is used to treat severe depression and some other psychiatric disorders, and it stands to be one of the most evidence-based therapies in psychiatry. The next bizarre treatment that made it to my list is leech therapy. If maggots are the tiny surgeons of wound care, then leeches are vascular surgeons of the animal kingdom. Leech therapy has been used as far back as ancient Egypt and all the way into the 19th century leech mania, when leeches were used for everything: fever, headaches, gout, you name it. And then as medicine modernized, leech therapy fell out of favor until microsurgery changed everything. When surgeons reattach a finger, an ear, or a lip, they do so by restoring the arterial blood flow. That means the blood is able to get in, but sometimes the blood has trouble getting out. That's because the veins are either so small or severely damaged. This is exactly where the leeches come in. They attach to the digit, feed on the pooled blood, and are able to remove 5 to 10 mLs per feeding. Not only that, they're able to simultaneously release a potent substance called anticoagulant, or a blood thinner, that promotes blood flow freely between feeds. In microsurgery, this allows the tissue time to build its own drainage system, and this is the difference between a lost ear or a saved one. This is trepanation, or drilling a hole in the human skull, and this procedure goes back at least 7,000 years. And you would think that an outcome of such a procedure, without antibiotics, without anesthesia, and any know-how of neuroscience, would be bad. But surprisingly, archaeological evidence shows that particularly in pre-Columbia Peru, the outcomes and survival rates were actually pretty good for its time. So the ancient surgeons may have started off by warding off evil spirits, but ultimately they stumbled into a very important concept: decompression, removing blood or pressure from the brain. This is what modern surgeons do still today and call it burr holes or craniotomies. Same idea. Now to my question: how many of these therapies that we covered today do you think are cleared by the FDA? The answer is all 5. They've been reviewed and cleared for use. Which of these treatments did you find the most surprising? Send me a comment in the comment section. I do read them. I'm Dr. Asya Mubashir. If you like my videos, hit subscribe, like, and share, and I'll see you next time.